Thank you, Dr. Jarkowski, for your encouraging words. I would like Dr. Sarah Bula, who is our graduate program director, to also, she's going to play a very important role because this is a graduate students who are in their advanced standing are going to be eligible for this grant. And it's very important that our field coordinator, who is also working as a cameraman, Paul Brinker, and Sarah, are very important partners in this initiative. So, Sarah, if you would like to, say something.
Okay. I'm not going to have a big, long speech at all. What I'd like to say just comes from my own experience. I'm an alum of this program, and 1993 I got my MSW, and I was fortunate in the practicum sites that I had, and the supervisors that I had, and the people I worked with, and I felt like I got through the program with everything I needed to be successful as a social worker. But it wasn't, there was always this nagging, could we be doing more? Is there some better training? And when I came on board as faculty here, I kept hearing students say, we want more clinical training. We want more, and this is going back for many years. And always trying to figure out how do we do that better. And this is one way we can do that, and this is one way we can offer not only the training and the preparation, but you actually can have that on your resume. It's a fellowship. It's state of the art. It's evidence based. It's a joint effort between the community and the school. There's so many good things about this. And I'm so impressed with Dr. Mukherjee's ability and his partnerships to pull this off, and it's just really exciting. I'm so glad that you have this opportunity. I was lucky when I went through the program, but I think you guys are even more fortunate than I was. MSW is the best degree ever, and this is going to make it even better. So welcome, and I'm really excited to hear about it, so let's get started.
And I want to, Paul is going to play a very important role because this training is to be coordinated with the field, and so any kind of during the training time, if a student needs to coordinate with the field field practicum hours, and if in the placement. Opportunities to apply some of the stuff that we discuss in our training is we will go through Paul to make that bridging between the field agencies and our training program. So Paul will play a very important role. I would like Paul to say something.
Thank you. I wasn't prepared with anything, but I always carry a speech or two around with me. Just in case it called upon to make a few words. No, I'm very excited about this, and I take this very, very seriously. I've already made a couple of inroads in the child welfare side of this part to start talking to some of our placement sites about letting our students actually practice what they learn. And I think that will be a pivotal role. I think it's going to be a new crossroads where our students actually, while they're in school and while they're in their internships, get to apply the training they're going to learn. And I agree with everything else everybody else has said, so I think I got my job kind of cut out for me. It's going to be fun for me to forge old relationships, new relationships in a different way to create a different type of internship for this particular program. And the program will do nothing but grow over the next 3 years, and I think we have another potential for 3 years after that. Figuring out ways to evaluate what you're learning and how you're applying it. We'll have to deal with all that, but I'm just excited about the opportunity for you and for your future clients. Thank you.
Okay, now I am going to give a little bit background of this grant and how it came about, and then we will introduce our trainers and take some questions and answer questions that we can answer for you. This has happened because, after my tenure, I have gotten involved with our, IEA grant, the Integrated Assessment, the PRIDE grant, and I have, started doing research on, and got involved with, children and the child abuse, and got exposed to many trauma-related, issues. And I think that Dr. James Courtney here, who is one of the very big resource here in our social work community, and I would like at some point to collaborate with him and play, him to play an important role, and Susie Shellock. Thanks for coming here. And during the spring semester last year, I had a field visit. I was teaching a seminar class where I got to meet Ginger, and Ginger is one of the most driving force in this grant. A lot of conceptualization to this whole program. Without her, I wouldn't have been able to put together this proposal. So, and she's going to talk about it soon. What we thought about is that giving, as I understand from Ginger and as I read the literature, that trauma-informed approaches to social work is becoming more and more very cutting edge and very upcoming in various places, and especially in our community. There are a lot of initiative that Ginger and the Behavioral Health Consortium is taking to create a workforce in our community that are trauma informed and can use trauma lens to work with different clientele. And I think that this population, when the grant announcement came in of children, adolescent, and transitional youth, that is 15 to 25 age group, and it's giving expertise on various components of trauma. I thought that this is a great opportunity for us to apply, since we have the PRIDE grant and the IEA grant, which can kind of very well collaborate in our creating an ecosystem of work and research on children. And so we conceived of this fellowship, and this is a federal fellowship, and we are one of those few schools that are offering this federal fellowship that student can be very proud of. You can write in your resume that you gotten a fellowship to attend a few sessions of. We have conceived around 25 or 26 sessions of half-day workshops on every Friday morning, and Paul is going to work with you if your agency and coordination is needed. And one of the main motivation for this is that we wanted to create a community of students or attract students. The first year we are drawing it from our pool of students. The second year onwards, in different places we are going to advertise so that we can get a lot of people in our school where we are offering this. We are very few. In fact, when I went to the CSWE, we had a special session where we were invited a few schools, 30 or 34 schools that who were represented in our conference in Tampa last month. I participated in that, and they are creating a listserv, and they're very proud of our initiative. So, if after your graduation, if you want to join the field, if you want to do higher studies in the future, one of the things that we want to create is a good expertise of very motivated students, so that you can be proud of being a fellow. Proud of being a federal fellow. You can proudly write your reputation. It's a very good thing. And of course, this series of training, the way it has been conceived, it is going to create cause a capacity building, and of course there is a $10,000 stipend that is associated with this. But I think that more than the stipend and the money, it's the content of your training that is going to fill an important void that in our program that you should be very motivated about, and also the federal reputation that you can carry in your curriculum vitae. Now the thing is that due to the timing, the federal government is not very well with their timing. They had in the grant mentioned that they're going to let us know everything by August, and we are going to start this in September. But in August past, we were wondering what happened. We wrote this grant, me, Ginger Mayer, and Kim Sanders. We all, is Kim here? Yeah, Kim is one of them. I went to the Kim. The first time I got this idea, I went to Kim. I talked to Ginger, and it happened that Ginger and Kim knew each other, and we all met together. Put your heads together and thought about this thing. So when we prepared the grant, we didn't know anybody. We just uploaded it on a federal website. We uploaded the grant. It went in through our OSPA. I kept on every week checking. What is it? It is in the review process. It's in the second review process. It is being assigned some numbers. They are deciding on this is going to go, and I'm waiting, bated breath. What is going to happen? And then suddenly, on the day that this grant happened, and I got a letter. The letter went to my junk mail. I didn't know. suddenly, and that day I didn't even check that website. And Wayne Glass from OSPA sent me a congratulations note. I said, congratulations for what? Then they say, you got the grant. I said, really? All that? It's all that money. So I felt that this is an idea that went over the website. All anonymous people saw our idea on paper without seeing our faces, and they decided to give this money to us. That's the best thing about it. And so we were very happy, and I kind of, I was very happy, and I started running around. And she saw me, and she said, why you are running so fast? But the thing is that since we got to know this way late, we had to make some adjustment with our initial plan. The initial plan is that which is going to be from next year onwards. This grant is going to start in September and is going to finish in May. But since the federal government got it a little delayed, every school is adjusting to this new timeline. So this is going to, this is not going to affect your graduation at all, but you may have to come for half a day during, after your graduation for a couple of months. And since this is, we are working very hard, and Dr. Jerkowski and Judy Wright and myself are working very hard with the university to make sure that it doesn't affect your graduation date, but after that you can, and this is for only the first year, folks. The second year onwards, we are on our schedule when we are going to finish it in May. But this one is going to be a little, it will go till the end of July. So you have to keep that in mind, and you have to, since this is a very important initiative, and we want our fellows to be, keep that in mind as they commit to apply for this opportunity. So we have some important dates that, as you know, already I said this is $10,000 fellowship. We are putting together a website, and there is I can email everybody a website. This website is still under construction, where a online application procedure would be there. You can go online and apply and submit it in there, and we will get it. But we also had few application forms physically for some of you to carry. If you can carry, and if you can photocopy it from your friend and send it to me, that's also fine with me. That's the reason I have kept few application forms that are in hard copy format. And so on before the Thanksgiving, we expect all our application to come in. Then our core committee that involves myself, Ginger, and Dr. Horton, our consultant to this grant. Dr. Horton will soon talk. We are going to look over it. We have put together a set of criteria, and then we are going to, those who are going to be selected as fellows will get a call and a notification on the 10th of December from me. And then on 16th of January, there will be a little orientation for fellows. We have put together a special packet for them. We're going to welcome them. We are going to call somebody. We're planning to call a keynote person who is a trauma specialist to welcome them as well on 16th of January in the morning at 8:30, and we are going to announce the venue very soon once we finalize. And after that, on January 23rd onwards, we are going to have this weekly, apart from a couple of weeks when the graduation and the spring break are there, half-a-day workshops on various aspects of trauma, an overview of brain development and its effect on trauma, manifestation of acute trauma, how DSM-5 can be used for a trauma diagnosis. We have a series of trainings that and supervision where it is so well sync with your field placement. Even if you are finishing your field placement, we are going to still continue doing that till the end of, on 24th of July. On July 31st, we are going to have a conference and a fellowship. We are going to give you the fellowship, and we are going to have a conference type of thing where we are again going to plan to have speakers from national speakers who are known for trauma-related research and practice. we are going to have that, and we are going to conclude our first year of fellowship that way. During that time, in the spring onwards, we are. I know that there are some students here who are thinking of applying for grad school next year. So you are a good candidate, or those of you who are in the first year of our master's program, 2-year master's program, you will be eligible for the next year's application, which we are going to start from spring onwards. And then, we will, for you, the fellowship will start from next September onwards. So, this is the way this is going to flow. And I have a series of what are the different trainings we have put together. If anybody interested, I can share that with you. Now, going back, so the selection criteria, you have to complete your application. We are not asking for any kind of references in letter form, but we are we have a one-page application form where you're writing your basic academic record. We are looking for your interest. 1 page of statement of purpose we are asking you to write, in which you should highlight that your interest in working with this population, at some point, your interest in trauma as such, because even if this population is very crucial, but trauma also affects even if you later on work with other populations, but the skills of trauma-informed practices is very important that you should consider. A commitment to excellence, a pride and commitment to the fellowship, a responsibility, that is more important. We want to create a sense of identity, a sense of pride. That should drive you. That should be the motivation. Though we are offering a very good stipend, a very good stipend through our university. When I was talking about negotiating, talking with our financial aid and other bursars about how to do fellowship, and they were saying, yeah, you can do various type of way. You can disburse the fellowship, giving a gift card. We have had fellowship for $100. I said, no, this fellowship is $10,000. They were like, really? So this is a real, very big fellowship. So, you should be very proud of that. And this is a federal money, federal government money, which should be recognized all over the place. If you know that this is the Department of Health and Human Services, the Health and Resources Services Administration, in short form, the HRSA, it's known, which has kind of, sanctioned this grant. They have already put together a listserv for the people who have gotten this grant. We are going back and forth. There are different schools all over. We are going on in ongoing discussion. Everybody knows about it. I've got congratulation letters from University of North Carolina, Chapel Hill. I have got congratulations letter from University of Illinois, Chicago, University of Nevada, Reno. We have got San Francisco State University, and then we have University of Chicago. I was like, really? That's good. We are in the map. So this is me. I'm an associate professor. I'm the program director, program principal investigator. I am myself educating, and that's the reason I tell everybody, all our experts, that I'm reading very voraciously about, because I want to also want to understand the literature about trauma. I am educating myself that, and I am planning to go to various conferences and trainings to educate myself. I'm putting together an evaluation evaluation of this training. I'm putting together an evaluation instrument. I will be responsible for evaluation, making sure the program runs well, and an individualized supervision of a student, and also this management of the human resources that we have put together. And then we have Ginger, and Ginger is going to speak for herself, and she has been the conceptual driving force for this. I wanted, she has created such interdisciplinary, field-driven, people who are doing this, training are all who are practicing as well. That's so important. And Ginger is going to talk about it, and then we'll move on. Yeah.
So this is so exciting. I'm so excited to see so many people. When we were conceptualizing this program, it just so happened that we had already built the framework for what was to be with the professionals that are up here, that I call everybody friends here, and colleagues. I've worked with the Center for Rural Health and Social Service Development on something called Children's Mental Health Resource Network, and we're working on pooling together all the resources in the 23 counties for mental health for children. And so both Ruth and Kim have worked tirelessly with me to try to pull together all the resources for that. We put together an advisory committee for the Children's Mental Health Resource Network to create a network of people who can provide services to children. one of our first initiatives was to increase our workforce, our existing workforce, because a lot of people don't have training in the trauma interventions that it's going to take to really help some of these kids be productive adults later on and break some of those generational cycles. One of the things that's being researched now, and you may read about it, is epigenetics, where actually the very trauma that causes trauma to families is actually passed through DNA. So that later on, when families have children, those children have a lesser capacity to handle trauma. And it's been researched that DNA has changed. It can be changed back with some intervention. And so that's what we're hoping to do, is to really, really drum up the workforce. And so I did have an intern last 2 semesters ago, and Dr. Drew came to my office and we were talking about different things, and he was very interested in our work that we were doing, putting together this network and talking about children's trauma and thinking about a learning collaborative in the intervention called Trauma-Focused Cognitive Behavioral Therapy, which we're actually going to do with professionals that are actually already working in the field and have their master's degrees and licenses. And so we're working on that initiative as well. And so he was very interested in that. And Kim came across the grant. So thank you so much, Kim, for putting it out there and making this happen, because you're the reason why we're all here, really. And so Dr. Drew said, what do you think about this? I said, oh, yes. This is great. We can drum up the workforce in another way, in the student population. So that way we can make sure that the students who graduate know exactly what they're doing when they go out and really do this therapy and clinical work with kids. It's so important, because as a person who refers children to therapists, sometimes bad therapy is not good. And so, no therapy is better than bad therapy sometimes. I hate to say that, but it's so true with these children, because it's such a very, very specific type of intervention that you have to do with traumatized kids. And so that is what the fellows are going to learn. They're going to learn how brain trauma affects children, how it really rewires their brain and really makes them who they are, makes them to be the person that they're going to be. But you can actually use these therapeutic interventions to help shift those brain pathways that are already there, to help rewire that brain. And there's been tons of research out there on that. These are all evidence-based practices that we're going to be teaching in these training modules that we set up. And in building the network and the capacity, I met some really great people who understand trauma and understand how to treat trauma, and they're up here. And it's so exciting that the community members who are treating these children and doing such great work in our community are going to be the ones to teach you this. And so that is so exciting that they're going to be able to give you a half a day on Friday of their time to be able to pretty much one-on-one, because it's 1 to 23, and then Dr. Drew will be in there as well, and we're going to have a lot of interaction. We're going to be talking about these cases. We're going to be able to put those things that you learn in a classroom into practice, and then come back and talk about those cases and have people who have years of experience in working with children to help you sort through some of those things. So it's going to be, you're going to have so many people surrounding you and really learning about, trauma and all of those things, that when you graduate, you're going to be hitting the ground, ready to go. And most importantly, people are going to want to hire you because you're a fellow, and you're a fellow from the SIU School of Social Work. So thank you so much for coming, and I look forward to seeing most of you in the classroom and being able to interact with you.
Thank you, Ginger. We have children mental health track, mental health track, children and family welfare track, and the school track. And trauma kind of affects even across the field. We have got people from all our 3 tracks are work with this population. So our next, we have Dr. Carla Houghton, and she is our assistant professor, and she works on schools. She's a school social worker. Her specialty is school bullying. And when I talked to her, she was very interested in connecting the bullying literature with trauma. And then I invited her on board, and I said, that she is going to be a very important in the supervision component of the training, where she will connect the training with the bullying literature. So Carla, if you want to say.
So it is now.
Yeah.
Like you said, I'm sorry, I put a cough drop in my mouth, but okay, I'll try and stick it to the side. 10 years in practice as a school social worker in the states of Florida and Texas, Miami-Dade County Public Schools in Florida, and Cedar Hill Independent School District in Texas. And in those times, I've dealt with some traumatic experiences, or the children that I've dealt with have had traumatic experiences. Some of you all have heard my spiel about crises in the schools, and some of the crises that I've had to deal with, like the murder that happened in my school. I see my school social work from, there you go, from last year. Where's my, oh, there you go, okay. I just wanted to make sure they were here. But a lot of my experience comes from, just having to do all of these counseling issues and how the trauma comes out in children. And it's much different in children than it is adults. And I know I'm speaking, I don't recognize a lot of you all's faces, so some of you all are in the mental health track. If it was one thing I told you, what was it?
To choose you instead.
Of course, yes. And why did I tell you schools was the most important?
Umbrella.
Exactly, because even with mental health and adults, they have children. So it's the one thing that you cannot avoid due to mandatory school attendance is the schools. So based off of that, you have to deal with, if you're thinking in a systemic perspective, then you've got to deal with way more than just your client in the hospital. You've got to deal with, well, what's going on with their child and how that child is affected, and what's going on, how your client's issue might be traumatizing their children. I've dealt with a number of different things, so I really think that the school social work aspect is going to be interesting. Now to talk just a quick bit about my area of research, which is bullying. How many of you all saw this? I just got this in my inner office mail from one of my colleagues. Yeah. She knows that my area of research is bullying. It's 2 articles in the Sunday. I hope this is not the Sunday paper, because if so, that's kind of small, huh? Anyway, but talks about just right here in
Is it the Anna's Jonesboro?
Anna, Jonesboro, and then did you all hear about the suicide last night?
No.
Okay, so you understand how serious school social work is, bullying is, and trauma is. Those things have a trinity that just cannot be broken. So just, no matter if my students tried to get away from me and didn't want to deal with the school aspect, we're still going to deal with it in the sense of bullying, schools, and how to deal with trauma in the school setting, or how the school really relates to trauma when it comes to being a breeding ground for bullying.
All right. We have got slides for all our trainers. Few of them could not come because they're stuck somewhere, or there was some other program going on that they are participating. But I would like to take this opportunity to introduce some of them. We have Dr. Kathy Swofford, is that the way? And she's the director of the SIBHC Children's Medical Resource Network, and board certified pediatrics and child abuse pediatrics, and a member of American Academy of Pediatrics and the Illinois chapter of AAP. And what's that AAP?
American Academy of Pediatrics.
American Academy of Pediatrics. So medical doctor, and she is if you can, Ginger, if you can highlight her, she would be more of talking about the brain, influence of trauma on the brain.
Just the medical aspects,
Medical
of child maltreatment and how that affects children.
Yeah. And then we have Dr. Matt Buckman. He is also very important. He contributed greatly to the conceptualization of the grant, and I am looking forward to meeting him. He is, he's a clinical director and a child and adolescent division of Egyptian Public and Mental Health Department, His expertise is trauma-focused cognitive behavioral therapy and parent-child interaction therapy. And he is going to hold a couple of few sessions with us. Then we have Dr. Saxon, Voleda Saxon, and I'm already working with Voleda on several projects. And Voleda, if you want to, you're representing the erstwhile age group. When this grant was prepared, it was age group, and we had John and age group helped us with some very important information that we put together. And if Dr. Saxon, you want to say something.
So, before I talk about myself, I just want to say that's some nice money for that grant. My goodness, when I was in school, and it wasn't that long ago, it was not that amount of money. My name is Voleda Saxon. I work as the Crisis Assistant Director in the Carterville Crisis Center. We assess youth and adults, so we see anybody of any age 24 hours a day for emergency counseling. So in the sessions that you're in with me, that's what we'll talk about. We'll talk about the trauma that comes along with that, and various other things for that kind of service when we're talking about emergency services at the Crisis Center and at the emergency department, and any follow-up treatment that they get after that. And I see Carol.
We have. I will let you introduce yourself.
Okay. I'm Marcy Malner. I graduated from SIU a long time ago. I've been working since 1985 with children and families in southernmost Illinois. And I will tell you, right now, we have some of the sickest children, mental health-wise, that I've ever seen in my career. And we have a system that cannot deal with them. They are very traumatized. They are very troubled. I could go on for hours about why I believe that is, but I'll save that for Friday morning. But we have to have a system that can prepare them better, and that's where you come in. You guys are going to build the future. You are the future of children's mental health, and that's why the federal government has invested in you and has invested in us, because if we're going to save these kids, if we're going to help these kids, we've got to build a system, and that's what we're doing here, and I'm so glad you're a part of this.
Thank you. Next we have Dr. Joyce Griffin, and if I may ask you to introduce yourself and say some words.
That's who I am. They got that right. I have worked for many years for Centerpoint Hospital, used to be Spirit of St. Louis Hospital, and I also have a private practice in Southern Illinois. I will say that the greatest number of child and adolescent patients that come to Centerpoint and have come there, averaged over the last 10 years, come from 3 counties in Southern Illinois. We are in St. Charles, Missouri, but Franklin, Williamson, and Jackson counties are the most numerous among our inpatient population. That tells you something about what's going on in Southern Illinois. In my private practice, a lot of what I do is work with child advocacy centers and work directly with traumatized children. And I use, at every opportunity, trauma-focused cognitive behavioral therapy because it works, because it does make a difference. I'm constantly learning and constantly getting all the training I can get, and I'm so sorry I'm not a social worker. If I had known how much more statistics and math there was in psychology, I would have never gone into psychology. I would also like to say that what you're doing that's so fascinating to me, and I was looking at Doctor and saying, oh my goodness, this is so wonderful. I think so many times we come out of our masters and we really have learned so much, but we haven't had enough opportunity for the practical use of it. And we feel almost afraid. So this is a way to really learn and then use what you learn, the practical knowledge, the stories that those of us up here can tell you about real kids and what we've seen and what they've told us and what has happened. So I think this is so wonderful. And yes, Verletta, what a wonderful grant. You are to be commended, every one of you. Thank you.
We have Dr. Mike Handwerk, and he could not be here. He is the licensed psychologist, and over 15 years he's a coordinator of outpatient behavioral health at El Dorado Primary Care. And hopefully you will see him, those of you who get selected as a fellow, in one of your sessions. And then we have Linda Calora, and I'll let you introduce yourself.
Hello, everybody. My name's Linda Calora. I've been in the field for about 30 years. I've been with what is now called Centerstone. It's been through 4 name changes since I've worked there. When I actually started, we didn't have cell phones and we didn't have computers. That's how far back it was. But what I want to tell you is that if there was one thing that I could leave with you today, that if somebody, when I was starting out like you, had told me, because I've done over probably about 2,500 at least that I've documented assessments of children and families through the years. And if somebody back then had told me, rule out trauma first. If somebody had told me, oh yeah, give me a second, I would have saved a lot more children than I have. Just that one thing, if you can just remember that one little piece. Let me get myself together here, because what I want to tell you is this is so amazing, because for the last 6 years we've been involved both at the state and the federal level in trauma-informed care and various different projects. Ran into Ginger probably, about a year ago or so, about that point, and we started realizing that we were working for the same cause and came together, and that's how we kind of got joined up. Worked with Joyce for many, many of years. We're one of the agencies that feeds into that. Marletta's awesome. I just met her. And, Sarah, we used to work together. Sarah used to work at a thing called the Network that we used to have, which was a crisis call-in center that because of funding has been cut. But many good things. Supervised hundreds and hundreds of interns at bachelor's, master's, and PhD levels. If you, through the fellowship, you come and have the opportunity to work with us. Our team is already a trauma-informed care team, from our receptionist to our billing staff to every intern. Everybody that works there gets trauma-informed care training so that our customers and our patients get it from day one, from the day that they walk in the door. So this is an awesome opportunity for you. I wish that I'd had this training when I started, so good luck to you.